Would you spend £500 on training and equipment if it gave you the chance to earn up to £70,000 a year? That is the endpoint of this idea. A mobile foot health clinic that taps into the aging population in the UK and the gap left by NHS cutbacks. The idea is simple. You provide routine foot care for people who cannot safely do it themselves. Cutting nails, reducing hard skin, treating corns and fungal issues. This is not beauty work. It's essential health maintenance, and the demand is growing every year. This business is perfect for anyone who wants stable and meaningful work with predictable repeat clients. And it works because you are not competing with salons. You are a clinical professional. You wear a tunic, follow hygiene standards, and become part of someone's long-term care routine. Once a client books you, they need you every 6 to 8 weeks. This is why the model works so well. You train as a foot health practitioner, not a podiatrist. Podiatrists need a 3-year degree. Foot health practitioners train through a diploma that qualifies you for private practice. You cannot do surgery or injections, but you can do the routine treatments that most people need. And you can train flexibly, often starting with a small deposit and paying monthly while you study from home. Now let me show you how this becomes a £500 startup instead of a £6,000 one. Training does not need to cost £6,000 up front. Most foot health practitioners qualify through a level 3 or level 4 diploma, and almost every provider offers payment plans. You can usually start the theory modules from home with a £99 deposit, then pay around £100 to £150 a month while you study. When it comes to equipment, you do not need to buy everything brand new. A refurbished autoclave and an entry-level drill can be leased from medical suppliers for £60 to £80 a month. When you combine training plans with equipment leasing, you turn a £6,000 startup into roughly £500 up front. If you need help raising that first $500, the free PDF in the comments shows you how to do it. You will not make serious money charging per treatment. The real income comes from structuring your days properly. A morning clinic or an afternoon clinic gives you predictable blocks of work and removes the gaps between clients. With a simple weekly route of regular home visits, you can earn around £3,000 a month. With care home contracts, that number climbs even higher. On the job, your car becomes your clinic. You need proper hygiene equipment, but you do not need to buy everything brand new. A refurbished autoclave and an entry-level drill are perfectly acceptable when you are starting out. Leasing spreads the cost and keeps your upfront spend low, meaning your first few clients can cover your entire monthly overhead. The real gold mine is care homes. When you work with individual clients, travel time limits your day. But in a care home, every resident is in the same building. You run a clinic day, work through a list of residents, and earn more in a morning than you would in a full day of home visits. Secure 1 or 2 homes on a 6-week rotation. And your baseline income is guaranteed before you even start booking private clients. Trust is everything in this business. You are working with vulnerable people. Wear a clinical tunic. Keep your kit spotless. Introduce yourself to local pharmacies. They get asked every day if they know someone who does foot care. Make sure you appear on Google Maps so families searching for help for their elderly parents can find you instantly. Becoming a foot health practitioner is a serious and hands-on career. You need training, insurance, and a strong stomach. But it is also one of the most stable and recession-proof service businesses you can start. You are helping people stay mobile, independent, and pain-free, and they will rely on you for years. This is Microbiz 365, giving you a new idea for a low-cost business every day of the year.